How is a patent foramen ovale, PFO, diagnosed after a cryptogenic stroke? Imagine a tiny opening in your heart that usually closes after birth but sometimes stays open. That's a patent foramen ovale, or PFO, and it can be a hidden cause behind some strokes. When someone has a stroke without an obvious reason, called a cryptogenic stroke, doctors look carefully for a PFO as a possible culprit. But how do they find it? The process involves several specialized tests that look at the heart and blood flow. First, doctors do a thorough check to rule out common causes of stroke. They use brain scans like MRI or CORT to see the damage, and vascular imaging to look at the blood vessels. They also monitor the heart for irregular rhythms, especially atrial fibrillation, which can cause strokes. Blood tests help exclude other issues. Only after these tests show no clear cause do they consider a PFO as a potential source. Next, they start with a simple, non-invasive ultrasound called transthoracic echocardiography. It uses sound waves to create pictures of the heart from outside the chest. While useful, this test isn't very good at detecting small openings like a PFO because it can miss tiny or transient shunts. To get a clearer picture, doctors often perform a contrast-enhanced echocardiogram, known as a bubble study. During this test, they inject tiny bubbles made of saline into a vein. If these bubbles appear in the left side of the heart shortly after entering the right side, it shows there's a direct passage, meaning a right-to-left shunt, through a PFO. This test can be done during a transthoracic echocardiogram or a more detailed transesophageal echocardiogram. Transesophageal echocardiography involves passing a thin probe down the esophagus to get close-up images of the heart's structures, especially the wall between the two upper chambers. It is more sensitive and specific than the transthoracic approach and can reveal the size of the PFO, the presence of an atrial septal aneurysm, or large shunts that increase stroke risk. Another helpful test is transcranial Doppler ultrasound with bubble contrast. This non-invasive test measures blood flow in the brain's arteries. When microbubbles pass into the brain's circulation during the test, it indicates a right-to-left shunt, making it a good screening tool. It's highly sensitive and often used to decide if further testing is needed. Finally, diagnosing a PFO involves teamwork. Neurologists and cardiologists work together to interpret the results, assess the risk of stroke from the PFO, and discuss treatment options. Some patients might benefit from medications to prevent clots, while others may be candidates for a procedure to close the PFO. In summary, after a cryptogenic stroke, doctors first rule out other causes with brain and heart tests. They then use specialized echocardiography with bubble contrast and sometimes transcranial Doppler ultrasound to detect a PFO. This careful approach helps identify patients who might benefit from targeted treatments to prevent future strokes. Always remember, if you or someone you know has experienced a stroke, it's essential to consult healthcare professionals for personalized evaluation and care.